Welcome back to the Neurostimulation podcast. I'm really excited today to have a conversation with Kelly Tuttle. Kelly is an expert in traumatic brain injury, and she's written a book called After the Crash that chronicles her own journey and her expertise in this very important area. So, Kelly, I wanted to welcome you to the podcast. I really appreciate you being here, and I'm looking forward to the conversation today.
Michael, I'm excited to be here and to get to speak to your listeners. This is really great. Thank you.
Yeah, thanks again. So I was curious, can you share with us some aspects of your personal journey with traumatic brain injury and how that has both impacted you, but also inspired you to write a book and to help others?
Sure. So my start begins with a thunderous clap of crunchy metal and shattering of glass, the deployment of airbags. I was in a car accident. A car had pulled out in front of me suddenly, and I T-boned them. And even though my engine was smoking and my car was totaled, I thought I'd be able to shake it off, the car crash, and go on with my life. And in fact, I actually went to work the next day. And since I was a nurse practitioner, I work with nurse practitioners and nurses, and they quickly picked up on changes in my behavior and my speech and encouraged me to see my primary provider the next day, which I did. And I was diagnosed with a concussion and taken off work for a couple weeks and felt like I should be better in a couple weeks. And then 3 months later, my symptoms are getting worse. I actually end up falling asleep at the wheel on the way home from work. And doing so, I mentioned that to a colleague of mine who at the time was a neurology nurse practitioner. I was a cardiology nurse practitioner. And she was curious to see how I was doing with my concussion. And I mentioned falling asleep at the wheel. And she said, that's not a good thing. And she said I should see a physical medicine and rehab doctor and get a brain scan. So I hadn't had any of that. I hadn't had a brain scan, very little follow-up from my general practitioner, and had not even had a referral to a neurologist or the physiatrist, which is the PMR doctor. And once I saw the physical medicine and rehab doctor, she knew right away that I had a serious brain injury. A mild concussion isn't really mild. And she set me on the right road to recovery. And then I finally started. She took me also off work for 3 months. And then I started on the right road to recovery and seeing the right specialist and getting better.
Yeah, that's good for you for overcoming that challenge. It must have been, I can imagine, particularly in the first number of weeks and months, even, that there were a lot of questions, a lot of uncertainty that you were probably faced with. Is that true?
Yes, I didn't realize a lot of the symptoms that I was having, for instance, feeling drowsy while I was driving. I didn't know that driving is highly cognitively draining. I stopped being able to listen to music because I had sound sensitivity. And I had started getting really bad headaches, and it was because of light sensitivity, being under the fluorescent lights at work. So it was really difficult in the beginning because I didn't know what was wrong, and then I was sleeping so much. And the other thing too was I was a martial artist prior to the car accident, and I used to be able to train for 2 hours at night after a full day of work. And when I started to go back to practicing, I found I would get winded and exhausted and have a pounding headache after 2 minutes. That was very bizarre. And with being on the road to recovery and having fantastic speech therapists and neurotherapists and seeing a behavioral neurologist and a behavioral optometrist, I learned different aspects of the brain. And my fascination with the brain and getting better led to me becoming very passionate about neuroscience. And a friend of mine, when I was telling her this, said, "Hey, you should go and be a neurology nurse practitioner. You'd be really good." provider. And I said, oh my gosh, that's a really great idea. So I did everything I could the next 2 years to qualify for a position. And I did get a position. And when I was sitting there taking care of those patients, I realized they were also struggling with the same things I struggled with. And so you asked me, like, why did I write the book? After that 3 months of being off from work, I was 2 weeks before going back to work, I was freaking out. I was like, how am I going to support my brain when I go back to work? I don't even know what to do. And it was hard for me to find strategies and compensatory tools because they were like in various books and on websites. And I still had a significant amount of cognitive fatigue, difficulty with memory after reading something. So that endeavor was really hard and
Mm.
it was very anxiety provoking. And so when I wrote my book, I didn't want someone to go through that. I wanted them to be able to look in one spot, find some easy to apply strategies, and use the compensatory tools I used to help me continue to work while my brain healed.
Yeah. No, that's fantastic. No, I think that it makes a lot of sense. It's really interesting to hear you talk about how there were those seemingly subtle things, but that turned out to be very impactful in terms of functioning. Like you say, the degree to which something like driving is cognitively taxing. There's so many things, it strikes me, that we do during the day that we take for granted from a cognitive performance perspective because it seems almost automatic. And then, as you say, if something comes along that complicates that somewhat, it's pretty amazing how quickly things can become much more difficult because of the need to focus in more intentionally on something and the degree to which we then become more aware of how tiring something ends up being.
Exactly, exactly. And so sometimes, like, I'll explain to my patients the neurofatigue. What happens is that if you have a brand new car, it has great mileage, takes very little gas to get from A to B. But if you have an older car, the tires are a little bit flat, the hoses are a little bit dried out and cracked, it's going to take more gas to get from A to B. And that's you still can get from A to B, but it's going to be a little bit harder. And so there needs to be that support if you are having issues with cognitive fatigue to get you from A to B, but also an understanding that you may feel slow, you may feel stupid, but that's not necessarily true. You're still smart. You just have to do things a little differently.
Yeah, I'm sure it's very valuable for your patients and for you as well in terms of being able to relate to one another and to have the ability, based on your own experience, to really empathize with what patients are going through and to coach them in that way that's very personal.
Yeah, I really felt like I was this ambassador bridging that gap between the patient and healthcare because they had the symptoms but had difficulty articulating what the symptoms were in ways that a healthcare provider would understand to attach that to a specific test or specialty or referral. And they really did appreciate me being able to articulate for them. They would say, my husband tries to talk to me and I'm having a hard time with my hearing. I can't hear.
Mm.
And I'll say, is the TV on? Are you in the kitchen? Are there people moving around you? And they would say yes. And I said, you you may be having what's called is hearing overload,
Mm.
and that's when you no longer have the ability, your brain no longer has the ability to differentiate sounds, and so every sound it gives 100% attention to, whereas someone who has a healthy brain, they can go, the TV's not important to listen to, this person is, now I'm going to focus the listening on this person talking. And then just explaining that and saying, hey, when you have a conversation with someone, it's not that you can't hear, it's because you're not able to focus on the sound you're supposed to be hearing. So cut back those sounds.
Yeah.
And you could do that by turning off the TV or even implementing technology such as active noise canceling earbuds or headphones.
Yeah, that's a really great idea. I really appreciate the metaphors that you've used, such as the car metaphor. We'll often use that in work with elderly people in terms of this notion of decreased cognitive reserve that happens later in life that cause similar kinds of challenges. And also that's a great tip that you've just mentioned in terms of using technology like the noise canceling headphones. I'm curious to know, I'm sure it's well detailed in your book, but do you mind sharing with us some other kinds of strategies that helped you with your own healing journey and that you often will coach patients in terms of using those strategies as well for themselves?
The number one thing I'd like to see people do immediately is journal, because the journal is going to help you in several ways, several aspects. It's going to help you hone down to where your symptoms are coming from. And then once you know the symptoms, then you can figure out what's making the symptoms worse. Then once you know that, then you can apply a strategy and see if that works, journal if it does or if it doesn't. And then the journal also allows you to see how far you've come in your recovery, because sometimes if your recovery is prolonged, you're going on 2 years plus, it gets very frustrating, depressing, and sad. But if you can look back in your journal and see how far you've come, then you can definitely pat yourself on the back. And then the journal is a great way to process emotions, because emotional modulation can be difficult after a head injury or brain injury. And you can process them in your journal. And if you're not able to get past them, cope with them, then you can reach out to friends, your support group, a psychologist, a counselor, get talk therapy. And then the other thing about the journal is it allows for practicing of mindfulness and gratitude. And both of those two things have been found to be very helpful in the healing of the brain. And that's one of the things when you've had a brain injury, you do tend to get locked in your brain. And when you're locked in your brain, you're sitting there with the bullies telling you negative thoughts, and you're reminiscing about this or that. And the journal helps you get out of that so that you can see where you're at, be more present in the moment, and be grateful for the things that are occurring now rather than reminiscing about, oh, that car accident and I can't do this now, and those kinds of things.
Mhm.
Really, the biggest tool is the journaling that I would say.
Yeah, that makes a lot of sense because I can imagine that for a number of reasons, the emotional toll of this kind of journey is really ends up being a big part of what ends up creating obstacles to overcome in terms of healing, not only because of the stress of the disability and the symptoms, but also because the actual organ that's been affected is where the emotions are processed, presumably, and experienced. So then it ends up becoming all tied up together. And yeah, it makes a lot of sense that with what you've described, those practices in terms of helping with the emotional processing is really critical. And I can totally understand why that would be an important part of your recommendation for patients, for sure. Yeah.
Yeah, and then I have the 5 pillars to your recovery, and one of them is sleep. I heard in your last podcast, you guys talked about the importance of sleep. That was great. When you go to sleep, a lot of people think the brain is not doing anything, but it's actually doing tremendous amount of work for your brain health. It's cleaning out toxins and waste, and it's modulating those emotions. So when you hear that saying, oh, let's just sleep on it, it's true. If you
Mhm.
sleep on it, your brain processes your stress and then softens the edges so you can cope with it better the next day.
Yeah.
And then while you're sleeping, your hippocampus, which is your memory center that gathers all the new stuff you've learned in your memories from the day, downloads those memories into the cortex while you're sleeping. If you're short on sleep, you short that ability to that process of happening. And so your memory won't be so good unless you're getting that 7 to 9 hours of recommended sleep. Let's see, what did I talked about the emotions and all that stuff. So anyway,
Mhm.
going back to the 5 pillars, sorry, I
Yeah.
digress. I'm very big proponent of sleep. So sleep, exercise, the mindfulness that we talked about, and nutrition. And then the fifth one is financial wellness, because having a concussion or whenever you have a chronic illness or a big injury, it can impact your ability to go to work and continue your income. I do talk about strategies on how to protect your finances while you're healing and maybe away from work.
Hmm. Yeah, no, I can imagine how. I really appreciate that you commented on that last part because it's not something that many people will incorporate into therapeutic program, but it's really important. And I think it makes me consider something I had a thought about just now, which is that when we were talking about how an injury like a TBI can really uncover things that we might normally take for granted in terms of our cognitive workload from day to day, like driving, for example, that seems automatic. But when that gets interrupted and we realize just how taxing it can be, I think another part of that is that how does that kind of feed into the stigma that arises often when other people who don't have that experience might put judgment on what they see as someone who doesn't seem to have a major illness because it's on the inside, kind of like mental illness in general. And so I think it would be, so with the financial piece, then I can imagine that there are these kinds of dynamics that would come up with employers and perhaps insurance adjusters. And so all of that ends up leading to most likely risks for a lot of complications in terms of someone's occupational wellness and their social wellness, with relationships perhaps being strained because, say, a significant other is feeling as though maybe someone's not trying hard enough or something like that.
And you're right, you hit it on the nail. It is an invisible injury, and if you haven't been through it, it's very hard to wrap your own brain around it. And I do have these kind of discussions with my caregivers and their frustrations, and I explain the reason why they're not motivated is because that's a higher executive function, takes a lot of energy to power, and your loved one doesn't have that energy. And so it needs to be broken up. And I give strategies how to kickstart it and sustain it. But I also say that if there's going to be with some individuals, irritability, grumpiness, and even bursts of anger. And I explain to my caregivers, when that happens, you have to remember that isn't the person that is doing that. They still love you and they appreciate all you're doing. Their brain is the one that's saying those things and doing those things because it's tired, it's overwhelmed, it's overstimulated, and it needs a break. So if you can balance when you start seeing those symptoms occur and then take them away from whatever is causing the overstimulation of the brain, then you can minimize the effects. Maybe just have a grumpy husband and not one having an angry outburst that they're not in control of.
Yeah, that
And
makes. I'm sorry. Go ahead. Yeah.
Oh, I was going to say that, and then that spills into the employment. So the individual will be told by the doctor, "Hey, you're better. You can go back to work," and they go back to work, but they're not aware, hey, that my job's cognitively demanding. I'm a knowledge worker. I'm unable to sustain that type of demand for the full 8 hours. And so they go back to work. They try to be the same worker they were before, highly proficient and enthusiastic. And they end up getting grumpy and irritable. Maybe they snap at someone, and then this can escalate. Everyone in the office is like, "Hey, Joe's kind of grumpy. What's wrong with him?" And then you could find yourself in HR and being terminated. But if we could send these people back to work with the tools and strategies that they need to help prevent these behavioral issues, then they'll be able to keep working as their brain heals and then staying healthy in society. Keep your job, you keep your relationships, you keep your home.
Yeah, that makes sense. And I guess it also makes me think again about that, how that whole dynamic with the emotional toll ends up being a really relevant factor in terms of the recovery and how things may or may not be going so well in the broader kind of social environment, and particularly with work, because I think these dynamics can be very subtle, but also very kind of self-reinforcing, because I guess the more that someone's struggling in fulfilling their role where they previously were high functioning and feeling as though things were going well, and then now not so much, and perhaps still somewhat puzzled about what are the underlying reasons, I can really see how the importance of just helping them and their family members to understand and advocate for themselves as much as possible, really, so that people in their circle can get a sense of that understanding as well, and to not be as judgmental, and to provide them with the space, time and space that's necessary for that healing.
Exactly. Yes.
Yeah. I'm just curious if, as far as other specific symptoms of TBI, like you've mentioned the irritability, I guess it strikes me that there's probably groups of symptoms like the emotional symptoms, and then perhaps more of what we might call somatic symptoms like actual headache. I'm just wondering if you could give us a rundown of those symptoms and some strategies for managing those specific symptoms.
Yeah, I think, let's see, I guess my favorite symptom to help with, I've spoken about a little bit, is sound sensitivity. And the aspect, what it is that the brain doesn't have the energy to put filters to filter out sound.
Mm.
So sounds can sound very loud to a brain injury survivor. Normal, everyday sounds, the refrigerator popping on, the fax machine, a phone ringing, a conversation. The conversations to me sound like people are yelling at each other sometimes, especially when I'm really tired or really trying to focus. And just realizing that, and then things that you can implement, like what I talked about, is utilization of active noise canceling technology. There
Mm.
are earbuds and headphones where they'll connect to your phone on your app, and you could actually control the amount of the noise canceling levels. So if you're in a conversation with someone, you can put it down to maybe 3 or 4. But say you're flying on an airplane and the air jet's really loud, you can bump it up to a 10. And that way you're applying an external filter for your brain and then saving the energy it would normally expend to power those filters.
Right. Okay. Yeah, that makes a
And
lot of, sorry, go ahead. Yeah.
I was going to say light sensitivity. If you're having headaches, you may be having some light sensitivity, and the light can be from outside. I've had people difficulty going outside. They wear
Mm.
hats and sunglasses to cope with that. It's been helpful. But in your normal office work environment, they utilize fluorescent lighting to light buildings and offices. And that can be very hard on the brain because that light's not constant, it's flickering. You may not see it, your
Mm.
brain perceives it as such. And when you work with computers, laptops, tablets, phones, they're sending out light. And that the light from that is blue light. And that
Mm.
can, if you're sensitive to blue light, that can be irritating, exhausting to the brain, and then cause headaches. And so with those, I recommend you could wear dark glasses. If you're in the office, there are fluorescent light covers that you can put over fluorescent lights. You could ask your employer to dim the light or just turn it off and use condensate lighting, light bulbs instead,
Right.
with a warm glow rather than a pure white is helpful. And then turning down lights at home, creating a quiet, cozier type environment at home. So when you're at home, you can really rest.
Mm.
So that's some of the things that I recommend for the light sensitivity. If you're having difficulty with reading, and again, headaches that can read, or dizziness, difficulty maintaining a balance, you really should have your eyes evaluated. And of course, everyone starts off with the optometrist, and optometrist makes sure that your eye clarity is good, that you see things clearly. But if you're having double vision or dizziness, you may want to consider getting a referral to an ophthalmologist. And they can, if you have double vision, they can prescribe prism glasses to help correct with that. And then there's behavioral optometrists. Now they look to see how well the eyes function together. And if you have a misalignment with your vision, that can cause headaches. It could cause neck pain because you're tilting your head either way to kind of level out that vision. It's called binocular vision dysfunction. And if you have that, some of the symptoms are neck pain, headaches, visual difficulty, decreased reading tolerance, decreased screen time tolerance. Did I say anxiety? Yeah, I think I said
Mhm.
anxiety. Those type of things that you would not put with your eyes. You wouldn't associate with your eyes. So yeah, if you're having difficulty with the reading and the memory and you're feeling anxious, you have headaches, get your eyes checked out.
Mhm. Yeah, no, thanks for summarizing all of that. It makes perfect sense. And I think, again, it comes back in some sense to what we've been talking about, the function that our body allows us that seems automatic and that we take for granted, like the seeing and the hearing. And it's not until things get off balance that way that we either get sensitive to light and or sound that we have to think more carefully about that and adjust how we're interacting with the environment in order to make it as comfortable as possible. But I think, yeah, in particular, it makes a lot of sense given how much we rely on screens and technology for most of what we're doing at work these days. A lot of folks, in terms of just recognizing, again, it strikes me that the education piece is so critical, because then the more that people understand about what they're suffering from, the more that they're then able to get help for it, but also advocate for themselves and to educate others who may not have the same degree of awareness.
Exactly. And that's where that journaling comes in and pinpointing your symptoms and then being able to better articulate it. So, say if you go to your doctor and you say, I have dizziness. Dizziness is non-specific symptom, and lots of things can cause dizziness. But if you go to your doctor and you say, I have dizziness every time I scroll up and down on my phone, I watch action movies where things are flying by, then the doctor's going to go, oh, they're having difficulty with eye tracking. So I'm
Mhm.
going to send them to a neurotherapist to help with eye tracking. So to see how important it is to really get down to the nitty gritty to help your provider understand what you're feeling, and then send you to the right therapist or specialist to take care of that symptom. Another thing is patients will say, I'm dizzy. And if I pinpoint it, I'll say, or they'll say they're dizzy and their legs feel weak. And which is like, why would they have these symptoms? And what they're describing is disequilibrium. And that is because the connection between the feet, the communication between the feet and the brain have been knocked off balance. And so that's why they feel weak in the legs, because they're just not getting this solid confirmation from their muscles and stuff. And then they're dizzy because they're getting misfirings of information to the brain. If you've injured your neck and you have whiplash and your neck is not aligned, that's going to make it difficult to control your headaches and your symptoms of dizziness also.
Mhm.
It's really it's a generalized injury that requires a holistic approach in care. A lot
Mhm.
of my patients will say, why can't I just see one provider just to take care of me? And I'll say, because the brain's complicated
Yeah.
and people specialize in various issues of the brain, and you just have to go and see them to create the whole picture of your healing and your recovery. I'll often say your speech therapist is a piece of the puzzle, your physical medicine doctor is a piece of the puzzle. I'm a piece of your puzzle in neurology. Your general practitioner is a piece of the puzzle. You put them all together, and that makes the picture of your plan of care.
Yeah, I think that's an important point to emphasize. I really appreciate that, because I think, yeah, it's important for people, again, to just not be afraid to advocate for themselves and to request the referrals, and if necessary, the second opinions, and just to be able to talk to people who have the expertise to be able to recognize the symptoms and make the diagnosis. But as you say, it starts with just having that inventory of the symptoms. And I really love the idea of journaling. I think it's a good idea in general for people who go to see their physician for whatever reason, to bring something in writing and just have something that they can refer to, because it's often hard when you I know personally, go to see my doctor, and then it's jumbled up a little in terms of the chronology of what's been happening. And so to have things written down ahead of time is a really good strategy, especially, I guess, in the context of a condition that's already causing some difficulty with concentration and memory.
Exactly. In fact, I brought a gift for your listeners. If they want to go to my website, kellytuttle.org, I've created I call it a stressless medical sheet. And on that sheet is the exact questions your doctor's going to need to make a diagnosis. So it's called old cart. That's what we use in medicine. So the onset, the duration of the time that you've had it, the location of the pain or whatever you're bringing in, the characteristics, what,
Mm.
stab, is it a stabbing headache? Is it a tight headache? What makes it worse? What makes it better? And have you had any treatment? Now, my form will walk you through that information. You fill it out. You can tell the doctor right away, I've had dizziness. It's worse when I'm under fluorescent lights. It's better when I get good sleep. And I'm sorry, brain fart.
That's okay. Yeah, I know.
And let's see here. Okay, we'll just leave it at that.
Is it? Yeah,
And
that's
then
okay.
On the form, it also has space for you to write notes and when your next,
Mm,
any recommendations, and then when your next follow-up appointment is, because you should have a follow-up before you leave the office.
definitely. That's awesome. I really appreciate that. I'm going to use that for myself. And that's fantastic and generous of you to make that available for viewers and listeners. I would encourage everyone to check that out. Super interesting, because I think this is where care starts, right? It's making sure that your provider has the best information possible to be able to help you in the best way possible, right? And so if it's disorganized and vague, then it becomes more challenging on the diagnostic side, but the more details, the better. And if it's written, it just helps people to be able to present that in a concise form that's going to be helpful for their provider. And then by but by definition for themselves, really. And also, just again, that point that you make about making sure that other qualified professionals as necessary become involved. It's super interesting to hear your story about how specific kinds of clinicians like behavioral optometrists become involved. I hadn't actually heard of that particular specialty until now, but I can see how it's really important in these specific areas for sure.
Yes, and that's I can speak to U.S. medicine, but here in the U.S., doctors and providers have a limited time with their patients. Some of them
Mhm.
only 10 minutes, and it can take you 10 minutes just to get your vital signs done by the medical assistant. So very little time, and they're under a lot of pressure to stay on time and see many patients in a short period of time. So if you can come in and be concise and
Mm.
have everything ready to go, you can take advantage of that little time and get the most out of it.
Yeah, definitely. No, that's really helpful. I'm curious to know, there may well be people listening and watching who have struggled with or maybe are continuing to struggle with these kinds of challenges. What would be perhaps some messages of hope and encouragement that you might be able to offer people who themselves are struggling or that have loved ones or acquaintances that they know are struggling with these kinds of challenges?
Everyone's recovery is different, as it's different and unique as their personality. And so their treatment and their symptoms will be different from one person to the next. And then the recovery doesn't, I know like a lot of my neurology colleagues would say, you'll see the most improvement within 2 years. And then what the patient hears is, if I'm not better in 2 years, I'm never going to get better. And just to realize that you can get better. There is this new information coming out about neuroplasticity, and maybe your brain won't be the same after your injury. Highly, most likely it won't, because it's so delicate and the intricate processes that occur that can be knocked offline with a stroke or a concussion. But if you support the health of your brain, you're going to support neuroplasticity, which is rewiring around dead cells, dead tissue, scar tissue in the brain. And if you encourage that with learning, being social, exercising, getting that sleep, eating a healthy, low fat, anti inflammatory diet, then you're going to encourage that process. And over time, you will see incremental improvements as the years go by.
Yeah, no, I appreciate that. It's probably important to give people or to encourage people to give themselves the permission to pay attention to self-care as well, because there's probably an inclination for people to feel like they just need to keep working harder or keep adding stress to themselves in terms of their expectations to get where they were perhaps pre-injury. But the self-care piece and allowing that therapeutic space and time strikes me as really critical.
Exactly. That's what I do, a lot of education on the fact that the brain and the nerves heal. They take a lot longer to heal and they take their own time. So there's nothing you can do to speed up the process. Unlike if you sprain your ankle, you could do your physical therapy, you could be really good at your stretches. But with a brain, it's more like you're just going to support optimal health and have patience.
I'm curious, what about the role of creative pursuits? Anything that someone might be interested in, perhaps as part of a self-care routine. Do you think creativity has a role, and is that something that you might suggest for patients to consider?
Oh, definitely. And this I usually put under mindfulness. So before my head injury, I did the martial arts. And when you do a kata, you are practicing mindfulness because you're thinking about the move, how your body feels, you're really in the moment. When I had my car crash, I lost that practice and I
Mm,
had to discover it again. And fortunately, I talked to a counselor and they recommended adult coloring.
mm.
And through adult coloring, I was able to learn how to sit and do my mindfulness practice. And yes, the arts are perfect. Listening to music is great for the brain, learning how to play an instrument, crafting, whether that's knitting or creating art, or even going to a museum and looking at the art there and thinking about it. All of that stuff helps the brain grow and heal.
Yeah, for sure. I'm curious if you have, as usual for viewers and listeners, the content here is intended for educational purposes only and not so much as advice for individuals. We would encourage you to see your own individual providers for that kind of specific advice. But I'm just curious, in general terms, as an educational piece, if someone's struggling with certain symptoms or functional problems, if they've recently had some sort of a concussion or other type of TBI, are there any things that you might provide them with in terms of just information that might help them through that difficult time?
Yes, so definitely keeping your general practitioner in the loop and letting them
Hmm.
know what's going on because as you're healing, your symptoms can change too.
Right. Yeah.
And especially if you've had an injury to the neck or the shoulder, that pain will
Mm,
cover up symptoms.
mm,
And so you really need to do a check-in with your provider. I recommend follow-up to be 2 weeks after the injury, the head injury, and
mm,
then a month after that, and then every 3 months after that.
sorry.
Uh,
Sorry, I have some background noise outside the window here. I don't apologize for the interruption
that's
there. I'm going to
okay.
just mute myself while you're talking. Sorry, yeah, carry on.
And then follow up every 3 months, and then for 6 months, and then every 6 months for a year, and then every year after because things can change. And I think that answers your question.
Definitely. Yeah, it does. Sorry. And I'll edit this and make it so that it's smooth here. So sorry about this background noise. There's a window here and must be some construction that's just started out there. So sorry about that.
That's
We'll just wait till it pauses and then try and get rolling. I'm pretty good at editing this kind of thing out and making it appear smooth. I'm just going to mute myself here for a minute until it stops. Maybe I'll just see if I can step out and ask them to stop in a minute if it doesn't stop. Hi, sorry about that. It looks like
that's
they're going to
okay.
just hold off for a few minutes here while we finish up. Okay, so just trying. Yeah, sorry about that. We had a little interruption there, but yeah, no, what you were just saying, Kelly, was interesting to me as well because it reminded me of something I was going to ask about earlier on in our conversation, which is the issue of pain. We haven't really talked about that, but as you said earlier, because it's such a general kind of disorder that involves many different physiological systems, obviously pain is a big part of that. And so I'm just curious, what would be some of your comments regarding the common experiences of pain, perhaps beyond headaches and maybe neck pain, and also some strategies on how you help patients to manage that pain?
I do have some experience managing the headache portion, but other joint issues, I really rely on physical therapy to help with it. And then I do recommend acupuncture for both headaches and neck issues and then massage therapy too. But the really interesting thing about headaches is that when you see a headache specialist and they prescribe medication, now they can prescribe you with an abortive medication to get rid of the headache, such as Imitrex. And then they can prescribe medications that you take on the daily called preventative medications to help. And the goal of that is to lower your headache frequency from down 30%. That's not a lot if you're having
Yeah.
headaches most days of the week. And what I've seen that is that if you're a patient that's not willing to do the lifestyle aspect of managing of headaches and chronic pain, it
Hmm.
doesn't matter what medications you take, it's not gonna be great. It's not
Yeah.
gonna be what you want. And so I'm really a big proponent that you really need to get the 7 to 9 hours of sleep. If you have sleep apnea, you need to be 100% compliant with your CPAP machine.
Right.
You've got to exercise in whatever form that may be. It could be chair yoga to going outside and walking. And you've got to be managing your stress and practicing mindfulness. And your finances need to be healthy too, because if you're
Yeah.
worried about your bills, it's going to be really hard to control chronic pain
Hmm.
issue. And then nutrition, you really want to be like on an anti-inflammatory diet. So
Hmm.
you want to be avoiding things that have preservatives in them. Yeah, dairy products are highly inflammatory. And so you really want to just eat closer to the ground to get the nutrition, more of a nutritionally dense diet rather than something that is like potato chips. It is low on the nutritional value as compared to the potato, having a
Yeah.
baked potato. And so I often tell my patients it's best to eat the orange rather than drink the orange juice. The
Hmm.
farther away from the factory you get and the closer to the ground, the better. And that's also very helpful with pain control. So
Yeah.
really staying away from processed foods, really staying away from anything that's in a package. If you can just eat it fresh. And that's not always easy, especially if you're trying to work and you only have so much energy. Just do the best that you can.
Yeah, definitely try to, at the grocery store, try to stick to the perimeter as much as possible and not so much to the middle halls
Yes.
or corridors. Yeah, exactly. Yeah, no, I love that educational piece around lifestyle factors for management of pain, chronic pain in particular, because I think there are a lot of potential pitfalls when it comes to prescription medication for pain. And we want to just try and help people to avoid getting dependent on medications for pain after any kind of injury, but particularly TBI for sure.
Exactly. And if you're not sleeping well, to seek care from your general practitioner to help you with that sleep. Let them know you're not sleeping well. If your sleep is being disrupted by neck pain or back pain, or you just have fragmented sleep where you wake up in the middle of the night and you're unable to go to sleep for 2 or 3 hours, they can help you with that. And then if they get to a point where what they're recommending isn't helping, ask to see a psychiatrist because people don't realize that psychiatrists are great at med management and sleep management. So those are the people you want to see when you need medication management for mental health. If you've got a tricky anxiety or depression mix that's difficult to control, or if you're having difficulty with sleep, that is a referral you want to ask for.
Yeah, definitely. I would echo that recommendation as a psychiatrist. I know a lot of colleagues who look after people who've had traumatic brain injuries, and you're absolutely right. I think because of that overlap with the emotional piece and the cognitive piece that we've been talking about, it really does make sense to, if necessary, to have a psychiatrist involved. So definitely agree with that one.
Oh
That's
yeah, and the
yeah, mhm,
behavioral aspect too.
mhm.
So,
Therapeutic wise, yeah.
yeah, the psychiatrists that's who I send my patients to who have difficulty with sleep, the mood, or the behavior. Very helpful. I love you guys.
Yeah, yeah. We're running a bit short on time, but I'm curious, just maybe if you don't mind just expanding on a little bit on that behavioral piece in terms of the relevance there, and not only perhaps in the sense of problematic repercussions of a TBI, but also on the therapeutic side.
So what I've seen in my own practice is bursts of anger, arguing. So they get stuck in this loop of arguing, this is why I want to do it. Motivation. So maybe not wanting to get up in the morning to take a shower. These things are exhausting for these people.
Mhm.
And or just to help out around the house. That can be helped with a psychiatrist if it needs to be treated with medication, but
Mhm.
also counseling, family counseling to help with other non pharmaceutical recommendations and therapies.
Yeah, for sure. It makes sense. It makes sense. So that's an important part of the overall treatment plan. That's great, Kelly. Thanks so much. I'm curious, where can viewers and listeners find more about your content or your practice if they're interested in connecting and learning more about your work?
You can go to kellytuttle.org. That's my website. You can find my book. I have an online program I'll be publishing soon. I have a YouTube channel myself. It's Brain Loving Advocate Kelly Tuttle, Brain Loving Advocate Kelly Tuttle. And I'm also on Instagram, Facebook for kind of just short spurts of information. The best place to go is to my YouTube if you want more of my content. And my book is also on Audible if you're having a hard time reading. And yeah, oh, and I have a Substack. So if you go to my website, then I'm going to be creating more content through Substack too.
That's awesome. That's great. It's great that you have the audiobook available. I'm a big fan of Audible. I think it's a great way to access books. And so, yeah, I'd really encourage viewers and listeners to check out all of what you have to offer. It's so great. And we will put links to all of that, what you just mentioned, Kelly. Well, for viewers and listeners, we're going to put links to all of that in the show notes. So I would really encourage you to check out Kelly's content. And again, Kelly, thank you so much for spending your valuable time with us today. Really appreciate your expertise and you sharing your personal journey. And I'm just so impressed with how you've translated that. It's really inspiring how you've translated that into all of this productivity and this content and how you retrained and you're helping out your patients now who have had similar challenges just to really help them to have the best health and wellness possible, even though they've had these significant challenges. So thanks very much.
Thank you for having me. It's been a great conversation.
Super. Okay. Take care. Thanks again. Bye for now.